6:05, and it's been about 2 weeks since kids under the age of 5 were able to get vaccinated against COVID-19. So new this morning, Taylor's back now. We're taking a look at where things stand here in the tri-state. The numbers maybe not as good as some had hoped, Taylor.
Yeah, Adrian, in Ohio, it's tough to say since state data hasn't been updated since last week, but those numbers showed just about 1% of kids under 5 had gotten at least one dose. In Kentucky, as of yesterday, that number was less than 1%. And to get them up, Children's is holding clinics for young kids, including one happening today. Appointments for today are fully booked, but many are open for later this month. They're geared toward young kids newly eligible to get vaccinated. And last week, the hospital's 2 clinics vaccinated about 200 kids in that age range. Primary care providers here have vaccinated dozens more. And nationwide, there's still some hesitancy. In April, about 3 in 10 parents with kids under 5 said they definitely will not get their child vaccinated, according to the Kaiser Family Foundation. We spoke to Dr. Robert Frank, who led the clinical trials for the vaccines, about what's holding some back.
Parents are saying, oh, my kid's a healthy child, they don't need it. That's not true. Is that the majority of kids that are getting bad COVID and dying have no underlying illness, that they were perfectly healthy kids. And the problem is I can't predict who's going to get severe COVID and who's going to get a mild case. And so that's why we have to really immunize everyone.
The CDC says 90% of kids 5 through 11 were hospitalized during Omicron's surge were unvaccinated. And Dr. Frank says the vaccine adds protection even if your child has already had COVID. Now at Children's, you can book appointments with your pediatrician or at one of the clinics. You can also book an appointment online at cincinnatichildrens.org.